What defines a traumatic event for a PTSD diagnosis? Imagine experiencing something so shocking or frightening that it leaves a lasting mark on your mind. That's what a traumatic event is in the context of post-traumatic stress disorder. According to mental health experts and the official diagnostic criteria, a traumatic event involves exposure to actual or threatened death, serious injury, or sexual violence. This exposure can happen in several ways. You might directly experience the event yourself, like being in a serious car accident or a natural disaster. Or you could witness it happening to someone else, such as seeing a friend get hurt in an assault. Sometimes, learning that a close family member or friend has been harmed in such a way can also qualify. Additionally, people like first responders or healthcare workers who repeatedly encounter graphic or distressing details of traumatic scenes are considered exposed to trauma through their work. For an event to be considered traumatic for a PTSD diagnosis, it must be perceived as extremely threatening or horrific. It's not enough for an event to be upsetting. It has to be seen as life-threatening or severely harmful. The official guidelines, known as the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, specify these criteria clearly. They state that the traumatic event must involve exposure to death, threatened death, serious injury, or sexual violence. This can include direct experience, witnessing the event, learning about it happening to someone close, or being exposed repeatedly to details of such events in a professional setting. After experiencing or witnessing such an event, a person may develop symptoms that last for at least 1 month. These symptoms include intrusive memories or flashbacks, avoiding places or activities that reminded them of the trauma, negative changes in thoughts and feelings, and increased arousal like being easily startled or having trouble sleeping. For a diagnosis, these symptoms must cause significant distress or interfere with daily life, work, or relationships. It's important to remember that not everyone reacts the same way. Some individuals might experience trauma from events that don't fit the strict criteria but still suffer emotional or mental health challenges. Healthcare professionals carefully evaluate each case, considering the nature of the event and the person's symptoms through interviews and assessments. This thorough approach helps ensure an accurate diagnosis and appropriate support. In summary, a traumatic event for PTSD involves exposure to life-threatening or severely harmful experiences, whether directly or indirectly. It must be perceived as extremely threatening and lead to a specific set of symptoms that last over a month and significantly impact a person's life. If you or someone you know has experienced such an event and is struggling with related symptoms, consulting a mental health professional is essential. They can provide personalized guidance and support based on individual experiences and needs.